In this procedure, you will learn how to instruct a patient in the steps of testicular self-examination. First, sanitize your hands. Then, collect your supplies. You'll need to give the patient a testicular self-examination pamphlet and a shower card with the steps outlined. To make sure you have the correct patient, identify him by name and date of birth.
Dean?
Yes.
My name is David. I'm the medical assistant working with Dr. Jones today. I just needed to get your full name and date of birth before we get started.
Dean Kellogg, May 12th, 19...
To put the patient at ease, explain what the examination is and how you'll be demonstrating it.
Okay, Dean. Dr. Jones wanted me to go over with you how to do a testicular self-examination. Nothing to be alarmed about. This is just something that they want you to do about once a month.
Begin by explaining to the patient that testicular cancer may cause no symptoms in the early stages. So it is important to examine the testes once a month for abnormal changes and early detection of the disease, beginning at puberty or approximately 15 years of age.
Do about once a month because the early stages of testicular cancer, there's no symptoms sometimes, so it's hard to tell if you have it or not. So it's just a precautionary thing.
Let the patient know that it's best to perform the examination in the shower or in a warm bath, and that the total examination takes about 3 minutes.
So I have some things today to give you. I'll go over this pamphlet with you kind of as we talk about it. Now, like I said, you want to do about once a month. Usually you want to do it in either a hot shower, hot bath, just to make it easier to perform.
Demonstrate on the model while discussing the technique. Instruct the patient to examine each testicle gently with both hands, applying a small amount of pressure.
So this is a good model to kind of show just how you would practice that, okay? So again, I'm just using my first finger and my thumb to roll around the testicle gently, make sure there's no lumps, nothing painful going on there.
Demonstrate how to examine the epididymis next. This is the comma-shaped cord found on top of and behind the testis. Tender when touched, it is the location of most non-cancerous problems. Check for hard spots and lumps. Continue by examining the sperm-carrying tube that runs up the epididymis, also called the vas deferens. Normally, it feels like a firm, movable, smooth tube. Feel once again for hard spots or lumps. Now, repeat the entire examination on the other testis.
And then once I've checked the vas deferens and the epididymis, I'm going to move over to the next one. Okay, so I'll let you kind of use that.
After completing the demonstration, ask the patient to do a return examination using the model. A male assistant might have the patient do a self-testicular examination. Give the pamphlet to the patient along with the shower card, with instructions to hang it in the shower as a monthly reminder and guide. Sanitize your hands again when finished with the patient. Document the instructional interaction in the patient's health record.